You're listening to episode 159 of The Secular Buddhist. Welcome to The Secular Buddhist. I'm Ted Meissner. The Secular Buddhist is the official podcast of the Secular Buddhist Association, a grassroots-driven effort to answer the needs of secular teaching and practice for contemporary society. The podcast has interviews and roundtable discussions pertaining to engaged Buddhist training and practice, and the SBA website has show notes for each episode along with resource materials. Though the podcast focuses on core practice from a secular viewpoint, more traditional teachings are welcome and openly discussed. Dr. Cathy Kerr joins us again to speak about her new paper, Mindfulness Starts with the Body, Somatosensory Attention and Top-Down Modulation of Cortical Alpha Rhythms in Mindfulness Meditation. What is it that happens when we meditate? We know what some of the effects are, we know how it makes us feel, but what is it that actually happens in that moment when we direct our attention? Studies over periods of time show physical changes in the brain, but what about before that, when we sit down and bring our mind on the breath the very first time? Dr. Cathy Kerr got her BA from Amherst College and her PhD from Johns Hopkins. She has been a lecturer at Harvard University and is assistant professor at the Department of Family Medicine at Brown University School of Medicine. So sit back, relax, and have a nice sleepy time tea. And our guest today is Dr. Catherine Kerr. Cathy, thanks for being here.
Thanks, Ted. It's great to be here.
It's nice to be speaking with you again, and I got to say I'm very delighted to have been following your Twitter feed recently because you're sending out links to these publicly available studies on the effects of meditation. So thank you very much for doing that.
Yeah, I sort of see my place in science as sort of really bringing together, basic science and sort of the best basic science with really good studies of mindfulness and introducing basic scientists to mindfulness and introducing people who are interested in mindfulness to some sort of basic brain science.
Yeah, I appreciate that, and it's going very well, and I wanted to catch up with you a little bit since we last spoke with you in episode 73 on your study, Modulating Somatosensory Attention. You were just transitioning from, I think, Harvard to Brown, and tell me, are you all settled in, and how's that been going?
Oh, it's been going great. We're actually building a contemplative studies initiative at Brown, and we're working together with humanists, physicians, psychologists, and basic scientists, and trying to develop a critical perspective on contemplative practice, and not just Buddhist practices, but on other Christian centering prayer and Taoist practice, and really introducing students to some of the ideas around these practices, but also to some of the sort of moment-by-moment experience, because we think that experience is really important for understanding contemplative practice.
Absolutely. And the study that we want to talk about today is your new one that recently came out. And let's see if I do have the title of it here. Mindfulness Starts with the Body, Somatosensory Attention and Top-Down Modulation of Cortical Alpha Rhythms in Mindfulness Meditation. Cathy, maybe you can help translate for us what the study was about and who your partners on this were.
Okay, well, basically what I've spent the last year and a half doing is really building on a study that we finished in 2011, where we found that people who trained in mindfulness were able to control the alpha rhythm in their hand map in primary somatosensory cortex, they were able to control it more finely. And the problem with that finding is that the significance of it was sort of unclear. Like, some people's reaction was, that's a great party trick. Neurons, but why should I care? Why should anybody who cares about health or well-being care about that? So what I did was I really started to just look at, there's a wave of new studies in looking at alpha modulation that are giving us a new understanding of how the brain works kind of at the information processing level. And it turns out that being able to do alpha modulation is really important for being able to being able to do alpha modulation successfully is really important for sensory processing and memory processing. So, and those are really foundations for well-being.
So tell us a little bit about alpha waves themselves. What are they, and how do they work, and how do we measure them?
So in order to tell you a little bit about that, I need to talk about the partners on the study. I worked on this study with Christopher Moore and Stephanie Jones. And Stephanie Jones's work is really interesting because she basically builds computational models of cortical columns, and then she tests her model by acquiring data in humans. And what she's found is that she's been able to develop a kind of sort of biophysically realistic model of alpha in primary somatosensory cortex. And the way that she's modeled it is that there's a feedback loop between the cortex and the thalamus. And what is happening to produce alpha is that the feedback loop is being subtly tweaked to either increase the alpha power or decrease the alpha power. And it's really quite amazing because these tweaks, alpha is a 8 to 13 hertz cycle rhythm. So, it's 10 times per second roughly. And so if you're tweaking that rhythm, you're doing that in an incredibly precise way. The thalamus is tweaking the alpha rhythm, changing it subtly, increasing the amount of sort of power in the rhythm, or changing the phase. And these are really delicate operations that are, up until now we've been unable to capture in humans. And so Stephanie's model is really important in that it gives us a picture of what might be happening at the thalamic level with mindfulness meditation. That the idea here is that mindfulness meditators are able to very subtly change the phase and power of alpha rhythms in a very localized manner in primary sensory cortex in response to changing context. So, if something's happening and you need to sort of close the attentional field and concentrate, you can use alpha to do that. If you need to be sort of broadly attentive to the attentional field in the way that you might if you were watching a child at a playground, where you're, sort of focused on the child, but you're also maybe focused on the environment around the child. All of that is likely facilitated by the thalamus setting a context so that it basically biases you towards what you want to pay attention to, and it allows you to ignore what isn't important. And so we think that this ability to modulate alpha is really important for managing stress and for promoting well-being. And it's probably important in chronic pain and in preventing depression.
Yeah, what I find particularly fascinating about what you're describing is that first, we can volitionally make that change. We can do a particular set of practices that have this effect that we can see, that we're able to do it. This is not something that we're not able to regulate. We can actually develop a skill to get better at this, and that the development of this skill helps us in a tremendous variety of ways.
Yeah, the basic question that we started with is mindfulness as it's taught typically begins with mindfulness of the breath and the body. And mindfulness-based stress reduction has a very heavy emphasis on mindfulness of the breath and body. That's the 8-week program that John Kabat-Zinn has introduced, and that's where the best clinical trials exist and real data about the benefits of mindfulness. But the mystery is the best finding in the mindfulness field is that mindfulness practice prevents depression relapse. But the mystery is that most of the mindfulness that's practiced to prevent depression relapse is actually very close focused attention on sensations of the body and breath. So the mystery is, why would close focused attention to sensations of the body and breath lead to lower risk of depression relapse? Do you see that's kind of an interesting question, isn't it?
It is, and the way you put it in the study, I'm going to quote from that is, our goal here is a rather more simple and pragmatic effort to answer the question, how does the specific ST mindfulness training sequence and somatically focused attention in the body and breath, focused meditative exercises lead to such a broad range of benefits? To me, that's, how does this work? It's great that we have all these studies that show, hey, here are these terrific benefits, but what your work with your partners on the study is starting to show is, and here's how.
Yeah, that we wanted to really provide a mechanistic bridge between the actual activities of practice and the actual benefits that have been documented in clinical trials. So, and I think that, people who are not familiar with mindfulness think that it's this sort of tuning in on your thoughts or, I don't know, sitting quietly and breathing. But I think what they don't understand is this sort of attentional training that is the sort of doorway into mindfulness and how body focused it is.
Mm-hmm. Yeah, there's a misperception of mindfulness meditation as relaxation, and very often we have heard that it does no more than taking a vacation. Just take a vacation instead; it's much easier.
Or take a nap.
Or take a nap. And granted, naps are great, vacations are great, but the thing that tends to not pay attention to is it's more than just relaxation, much as that absolutely is part of the mindfulness-based stress reduction. Of course, there is a relaxation component to that, very true. But what is really the primary focus and what you're practicing on is very close attention and observing what's going on in your body. And in the body scans, you're practicing not feeling your toes or feeling your knees. You're practicing shifting and training your area of attention.
And what's really interesting is that, when people start the mindfulness-based stress reduction, that's what they do for the first couple weeks of class. They just train that attentional spotlight on the body, sort of on body part after body part. And the question is, why would a sequence like that lead to improved affect regulation and improved cognitive regulation? And so what we were looking at was, well, what actually happens when you do that attentional spotlight training? And that's where our 2010 study became really relevant, that published in the Journal of Neuroscience. And what we found was that when people, just normal people, attend to your hand or attend away from the hand, they're actually in a very fine-tuned way, modulating the alpha rhythm in primary somatosensory cortex. And the reason that matters is because there's new evidence that this alpha rhythm is not just sort of a correlate of a downstream process, but it may actually be actively, mechanistically helping to either suppress or amplify sensory throughput in the cortex. It's very interesting because this 10 hertz rhythm appears to interact with another rhythm called the gamma rhythm, which is a very fast rhythm. It's very important for awareness and attention. And what that 10 hertz alpha rhythm seems to do is it seems to kind of nullify or neutralize the gamma rhythm. And that when it does that, when you have a lot of alpha and the gamma rhythm subsides, that means that you're actually, what it looks like is you're kind of taking that area of cortex offline. So you can think of it as sort of playing a piano, and you're focusing on some keys, and then other keys are not being used, and that's the alpha rhythm helps to facilitate that sort of that direct uh, working with some parts of sensory cortex and suppressing other parts of sensory cortex.
What would gamma rhythm typically be associated with, or does it have a particular association?
It's associated, it's actually, people are very interested in it as a rhythm of consciousness. And sometimes when something kind of comes into awareness, then what we see is a kind of a flash of gamma. And it seems to be this very interesting rhythm of where suddenly things kind of come together and perceptions arise, or representations are kind of knitted together in the brain. It's a very it's an important rhythm. It's a rhythm that we actually know a lot about mechanistically compared to some of the other brain rhythms. And it again with gamma, it appears that gamma in itself helps to increase the sort of efficiency and of neural processes. It's sort of this value added. In other words, the presence of the rhythm actually changes the way that the cells process the information. So I saw a question on your website on the Facebook page, and somebody said, well, isn't alpha just kind of what happens when you shut your eyes? Or isn't it just this kind of broad, kind of non-specific process? It's not terribly interesting. And that's a sort of older view of alpha rhythms. But what we're finding now is that it's likely that both alpha and gamma, that the rhythm itself and some neurophysiology underlying the rhythm are directly impacting how the cortex processes information and routes information through to consciousness. In other words, there's so much going on below the level of consciousness, kind of, just in terms of sensory input. Only a very small number of things make it into consciousness. It's these brain rhythms that help to determine what we become aware of. And so the idea that mindfulness initiates you in a kind of more adaptive regulation of these brain rhythms, of the alpha rhythm, is a very appealing idea. And so that's what we tested in our 2011 paper. And in a very sort of proof of principle way, we seem to find that meditators were better at modulating and using attention to control the alpha rhythm in a localized manner.
Tell us more about then the new study, how you set it up and what it was that you did.
So the new study is actually a comprehensive review of alpha modulation as a way of understanding mindfulness and well-being. So it's actually, in a way, what I'm trying to do is actually teach people about brain rhythms and somatosensory attention and their relevance for health. So what's important about the new study is the way that we brought together all of this really basic science, a lot of it from Europe. We brought that together with the mindfulness findings. And the reason it's important, I think, for people who are interested in mindfulness is that up until now, most people who've investigated mindfulness have done so from a kind of cognitive, emotional angle. And we're sort of sensory scientists and sensory perception. But if you talk to teachers like John Kabat-Zinn or Shinzen Young, they talk about perception. They talk about meditation as changing perception. And we think this is a really important idea that has a lot of relevance for understanding health. That, people have thought of mindfulness as this kind of thought exercise. But really, it's a way of changing your perceptual processing. And the alpha rhythm is a way of understanding that alpha rhythm modulation across the cortex is a way of understanding how that perceptual processing could be changed in this really kind of ground up way. from the ground up way. It's a way of understanding that. And it's also a way of understanding why that would be relevant for helping people with depression relapse and chronic pain. So that's sort of the value added of this study, is to sort of bring together that really basic brain science that's just emerged in like the last 5 to 10 years with these clinical findings in mindfulness. Because if you view mindfulness as a cognitive intervention, then the question is, why would you do the body scan? And so that's the question that, the cognitive emotional approach doesn't really have an answer to, I think. So what we're trying to do is help people understand how this is a sensory cognitive intervention, and that changing the way that you relate to your senses can change, your depression or your chronic pain.
And what I find particularly interesting about that, Cathy, is that this ties in perfectly, I think, with traditional Buddhist views on form, feeling, perceptions, our four foundations of mindfulness, if we look at it in that very broad classical sense, that this initial perception and that awareness, that these sense doors and the contact and the perception sounds like exactly what you're describing, and these are the physiological and neurological and rhythmic mechanisms behind that understanding.
Yeah, I mean, I think that that's sort of where we arrived by the end of the project, was a realization that perhaps this was a neural basis for understanding some really interesting Buddhist psychology theories. I mean, I don't want to put too much weight on that because it's really important to stay in the present with the science. But it is really striking that, I mean, the title of our article is Mindfulness Starts with the Body. And that's because the first foundation of mindfulness, as you mentioned, is the mindfulness of the body and breath. And, there's a lot of really interesting sensory perceptual theorizing in Buddhist sources about how relating to the way that you relate to your sensory perceptions actually kind of lays down a track for how you relate to your cognitions and emotions. And I think that that's actually a kind of not a uh, not a normative idea right now in psychological science. I don't think many people hold that view, and I think there's one of the issues in the science is that we were bequeathed to us the idea that sensation, sensory perception, and cognition are fundamentally different processes. And what we see that one of the most important sort of findings of our review in going over some recently published work is that this alpha rhythm is important for modulating sensory perception, but it's also really important in helping us form working memory. So there's actually working memory you can think of as a sort of internal intentional process. You're sort of remember where, you say to yourself, where, I remember where I put my keys, and you sort of make a note to yourself, and you're kind of putting something in working a short-term memory. And when you do that, you're one of the things that's really important when you put something in working memory that helps you recall it is your ability to modulate alpha. Because it turns out what you're doing, you need to turn down the volume on your sensory processing when you're working with memory. And it's basically, the way to think about it is that you have this spotlight that can be directed towards the external world, towards external sensations, towards body sensations, or towards thoughts. And alpha modulates all of those processes. So, that sort of provides a way of understanding how something like the body scan And learning how to modulate alpha on a localized level in sensory cortex would sort of translate up and help you modulate cognitions and emotions.
Wonderful. So you've got a few different parts of the study, and for folks who are listening to the podcast, I will have a link to the full study, and do take a look. It's because it's not only very well documented and clearly presented, it also has some wonderful references throughout. So it's a very good place for you to take a look for more information about this kind of topic. The first part, you're talking about the initial evidence in the system that it actually does enhance the top-down alpha modulation. Let's talk about that for a minute.
Right. So there was our study in 2011, which found that people that we trained in meditation were better at the end of the 8-week mindfulness program, did better at modulating the local alpha rhythm in their hand map in primary somatosensory cortex. So basically what we were able to do is cue them to attend to the hand or attend away from the hand. So, everyone in the audience can try that right now. So attend to your hand, okay? Just feel your hand. Now attend away from your hand, attend to your foot. Feel your foot. And feel what it's like to shift your attention from your hand to your foot. That's the experiment that we did with our meditators, and we had them repeat that operation like 250 times. And what we found was that the meditators were better at exercising fine control over the alpha rhythm in the corresponding part of the somatosensory cortex map that represents the hand. So, your viewers probably or your listeners probably remember that the hand is represented in the cortex in the contralateral somatosensory cortex map of the hand. And we've known for a long time that if we tap someone on the finger, you'll get activation in primary somatosensory cortex. But what's new is if you just shift your mind to your hand and you just attend to your hand, you're actually changing the excitability of the neurons in the hand map. And the way that you're doing that is one of the ways you're doing that is by altering the alpha rhythm in a really specific, map-specific somatotopic way. And so, people can do this a little bit on their own, but what the body scan and other forms of training do is they give you a really refined way of sweeping your mind through the primary somatosensory cortex map, really feeling what it's like to modulate your own brain rhythms. Because I don't know about you, Ted, but when I put my mind in my hand, I actually feel my hand. Is that the case for you?
Yeah, it is. In fact, as you were guiding me and the listeners through that attention, that body scan, we typically go through our day on automatic pilot, and we don't have that awareness just of our embedded physicality. When we intentionally set our attention to a specific spot, we may tend to physically feel it a little bit more, and granted, that may be something that's neurological, that's happening in our brain. There is something that's happening in our brain.
It definitely is, yeah.
You have a nice graphic to show that actually is that when there is attention to the hand, it's a decreased alpha power, and when you shift away from the hand, it's an increased alpha power. And so there's a specific neurological correlate to what we're doing. And folks may not be as aware that there is this map of our body's awareness that's in our brain. And so there are very specific areas we can measure that, this is the part that is tied to the hand, and this is the part that's tied elsewhere. So when we talk about shifting that, we really can take a look at, okay, and here's what's happening with our volitional attention shift. And to me, that's very fascinating because that fits into that self-directed neuroplasticity where eventually we see physiological changes and thickening of different areas of the brain based on some other folks' work. So it's fascinating to see this initial right away You don't have to wait, a couple of months for physical changes to occur. You can measure waves that are immediate that may contribute to that physiological change.
You can get, I mean, and the other thing that's really important is to remember that this is the moment by moment process of the mind paying attention to the body. And that's really the objective of mindfulness, is to make you aware of the sort of moment by moment process of your own mind. But how does it do that? You can actually, by attending to your hand or attending to your foot or attending to the breath, you can actually feel your mind's focus. And it's actually like you're kind of doing a form of neurofeedback. Does that make sense?
Yeah, absolutely. And folks who have done body scans, particularly if you've been doing it for a long time, when you start in an MBSR program, there's guided meditations through body scan. And eventually you get to a point where you can turn that off and you just do it yourself, because you now have the understanding of the rate of progress that we make through the body. And you can do it in a patient, slow manner and really put your attention and focus it on various areas of the body. And it does raise the awareness, as you were just guiding the listeners through. Think about your left hand right now. What does that feel like? Well, that's you doing it, but 5 seconds ago you weren't aware of it at all. So it's very simple. We can do that. It's continuing that practice moment by moment. We would expect to see that as we exercise the body and we become stronger, or we have more ability to run longer and faster and things like that, we should see that same kind of thing going on in the brain, because that is a part of our body.
Right. And anything that you repeatedly train, obviously, is going to cause changes in your brain. But the question is, how does it do this? And, what are the processes that are really facilitating that change?
Mm-hmm, mm-hmm.
And so, I think what's really exciting about this idea of teaching people this sensory cognitive view of mindfulness is that it gives them a really immediate doorway into experiencing their own attentional field. Because anybody can pay attention to their hand, right?
Yeah, yeah. Yeah, that's the wonderful thing, is that we are able to do this just by basic awareness that is inherent with being an embodied being who can intentionally direct attention.
Yeah, and there's nothing esoteric about this at all. It's a very common and ordinary process, and it's something that's, I think, could be very accessible to people, who have chronic pain or who are working with depression. And so one of our goals is to give people this sort of immediate kind of visceral, if you will, understanding of what mindfulness is about as a form of attention training. And so, that's where I think the mindfulness of the body idea from the four foundations is so brilliant and important, because it really does give people this immediate hook. It doesn't, you don't have to kind of go off into this sort of esoteric understanding of, high level thoughts and emotions. It's something that it's really a form of training or exercise. And I think for some people it's very helpful to hear that. I don't know if that resonates with you, but
Absolutely. And in fact, one of the things I wanted to share is that every month I get a report on what what books that they're getting off of our resources. And every single month I see that people are getting books that are around pain and dealing with pain through mindfulness practices. And I was just looking at part 3 of the study as you were talking, and we've had Fadl Zadan on the podcast before, and his work is on pain modulation and changing the way in which we relate to the pain is the phrase we use, but that's what you're talking about, is our perception of it is that relationship. So in your part 3 of the study, you do talk about what some of the clinical implications are for things like chronic pain and depression relapse. And as someone who does have chronic pain in my own life, I am well aware that meditative practices do help change that relationship. And you're describing some of the neurological correlates to that.
Yeah, so we know that alpha modulation is important for controlling pain, and we also know that in chronic pain, people with chronic pain can be develop a bias in their sensory field towards the painful sensation. And when this happens, what we see in chronic pain patients is a loss of attentional freedom. The attention gets sort of riveted to the pain sensation. And what we think something like the body scan can help do is it's in a way sort of debiasing or degaussing the sensory map. And it's sort of helping to take away that stickiness that the pain sensation has. The pain sensation pulls in the attention. And what something like attention to the breath and body can do is give people equanimity and give them attentional control so they're not just pulled into that sensation. And we think that when that happens, when they are able to have a more full attentional field, that there's changes in well-being more generally, there's changes in information processing. Because when there's a bias in alpha modulation, what we would expect to see or tend to see is that there's a lot more general loss of the ability to process information in the visual domain, possibly in visual attention, also in working memory. It appears that chronic pain affects working memory. So there's a way in which these very basic sort of sensory attentional biases in chronic pain patients may be sort of radiating out and kind of impacting the entire experience, moment by moment experience. I don't know if that resonates for you.
Very much so. And let's just walk through it. A general example is that as we practice shifting our attention from one part of the body to another, which is what we're practicing in body scan meditation, for example, we get better at that. We find a greater facility with being able to shift our attention from the hand to the foot. And although that seems like, yeah, big deal, so what? I could do that right now. When you are faced with something like chronic pain or an emotional state, which is a physiological state, being able to intentionally, because you've gotten good at it, you're now much more skilled at it, being able to shift your attention off of that gravity well of attention to a particular pain center that you have.
Be like a vortex,
It's a
right?
vortex. You get sucked in,
Yeah.
and anyone who, if you've been in a meditative retreat where you're sitting for an hour and the pain in your legs is excruciating, boy, how great it is to be able to shift your attention to the breath, because you can only really have your attention on one thing at a time, and we shift rapidly back and forth. And it's very, as time goes on, you're able to really maintain that attention on one thing and not the pain vortex that keeps drawing you in.
Although I think that one of the things that's very interesting about mindfulness is that ultimately you are able to attend to the pain vortex and not, in other words, the real accomplishment of mindfulness-based stress reduction, it appears, is that people are able to actually pay attention to their own pain with equanimity and not have a kind of, to really experience the pain, to feel it, but not be reactive to it, not have a lot of negative thoughts about it. And so that there's a way in which if you sort of lead your mind, say, through the body scan and engage all the 32 body parts, there are some parts that are going to trigger you, you're going to be very reactive to. And so engaging with that reactivity and watching how your mind reacts to your body is another way that mindfulness of the body actually teaches you about your own mind, teaches you about your emotional reactivity. And so, what we would predict or what we see in mindfulness-based stress reduction is it's not so much that the mindfulness relieves the pain intensity. it seems to relieve the reactive suffering to the pain.
Exactly. Yes. And that's something that, we've just talked about two different ways of dealing with, for example, chronic pain. One is shifting your attention to something else. And this is those who are familiar with the Vitakka Sutta, with the 5 different ways of dealing with distracting thoughts, replacing it with another, shifting your attention to something else. In this case, is what I was referring to and what Cathy is talking about now. And this is a body of the work of Fadl Zaidan, and I'll link to our interview with his work, because what Cathy's talking about really is what Fadl has studied, is that yes, you still do feel the pain. Actively engage with that. Use that as your object of meditation, and you allow that. And this is challenging. It's
Right. No,
not
it's
always easy
the faint of heart.
to allow that to simply be sensation rather than adding on the layer of suffering to it.
Or noticing how your mind develops this whole relationship and reaction to the pain, and just
Mm-hmm.
going right back into the sensation.
Exactly.
Yeah.
Exactly.
And that, so what we think is that reactivity, all of those processes disrupt alpha modulation. They disrupt the smooth flow of alpha modulation in sensory cortex. And learning how to do this basic somatosensory attention is restorative to this underlying alpha modulation process, by which the thalamus very subtly tweaks sort of the alpha rhythm, changes it subtly so that it changes the way information is routed in the cortex. And so information is routed more efficiently or more in the moment, the needs of the moment. Does that make sense?
It does. And what I'd like to talk about for a few minutes is a bit later on in this published work, you have a few hypotheses. Let's talk about some of those. What were some of the very interesting to you ones that came out of this?
Well, so we have sort of some basic science hypotheses, and then we have some clinical hypotheses. And the clinical hypotheses, I guess, is probably where we should start. Uh, there's actually a figure that we worked on a certain amount, which I think is, scientists work a lot on their figures, and they're not always so much. But anyway, the first figure, this is by the way, a publicly accessible article, so anybody can take a look at this.
And I do have this linked on the episode page, so go take a look. I'll have it there for you.
So the first figure actually sort of identifies our hypotheses. And what we did was we sort of identified, well, what's known in the literature, and then what still can be tested. And so what we know is that standardized mindfulness is very helpful for depression relapse and chronic pain distress. And so the hypothesis that we're forming, in which we're going to be testing ourselves and we're inviting other people to also test, is this idea that alpha modulation is going to be a mediator of the clinical changes. In other words, taking people with chronic pain who are not good alpha modulators, leading them through an MBSR course, what we would expect to see at the end of the course is that change in alpha modulation efficacy predicts change in improvement in mood and distress. Because what we think is there's just something that is going to be really helpful about learning how to, get that attentional freedom back, and that's going to be reflected in pain-related mood. And there's a particular, I don't know if Fadl talked about catastrophizing.
I don't think he did in that particular discussion, but that's a very good point, because that leads into depression modulation as well. Talk about that.
Yeah, so what we see actually in chronic pain and depression is that the sort of negative processing appears to be maintained by kind of continuous negative thoughts, rumination. So the rumination on, I'm a terrible person, or my life is awful, and just having this kind of repetitive thought that you cannot, that you are riveted to. Um, and what we know is that that internal processing of those types of thoughts is directly competes with alpha modulation attentional processes. And so if you can learn to sort of modulate your sensory alpha and learn to, really feel your hand, really feel your breath, one of the things that you're doing is you're actually turning down the volume on rumination. And what we see in the therapy designed to prevent the mindfulness therapy that's designed to prevent depression relapse, they ask people, if you get triggered in the middle of the day by a ruminative thought stream, you have an encounter with someone, and you start to realize or think, how awful things are. What do they ask you to do? They ask you to do a breathing space. And they ask you to really tune into the sensory vividness of your breath. And when you do that, you are modulating your alpha thalamocortical spotlight, and you are actually turning down the volume on all of those negative, distressing thoughts. So the way that it works is that it's very interesting. There's a lab in the Netherlands that's sort of the most advanced in this. And what they found is that your ability to focus on your thoughts or to focus on your memories is directly related to your ability to control your sensory volume, to control the sensory gain. You need to be able to turn down the volume on sensory cortex in order to be able to work effectively with thoughts. And the tool that the brain uses for doing that is alpha modulation. Does that make
Yeah,
sense?
it does. And for folks who want to find out a little bit more about this concept of rumination and how it relates to depression and dealing with depression, I'll be putting a link up to the book, The Mindful Way Through Depression, which really
Yeah.
goes at length on this topic and is a really wonderful resource.
Yeah.
Okay,
So,
so what other hypotheses? Let's talk more about those.
so we also have the hypothesis that, people who are at high risk for depression relapse, that there are changes in rumination and working memory that we would expect to see as they engage in a mindfulness course will also be related to or be correlated with their ability to control this basic alpha processing, thalamocortical alpha processing. So, what we're trying to establish is that this thalamocortical loop is sort of setting a context for a lot of different sensory and cognitive processes in the brain. And that's why we are trying to help people see mindfulness as a sensory cognitive intervention, not a cognitive intervention.
Yeah, I don't. Can they even really be separated?
Well, a thought is different from a sensation on some level. They're measured in different ways, but there's a lot of joint overlapping processing that
Yeah,
takes
yeah.
place. And what's really interesting about that is that in the Buddhist psychology, again, you don't want to make too much of this, and I'm sure you're actually more of a scholar of this than I am, but thoughts are a sense.
Yes, yeah. They are included in our sense doors in addition to our regular uh, feeling or physical feeling or touch and sight and hearing and taste and smell. That thoughts are also the mind is also a sense door.
And if you think about it from a certain perspective, that actually sounds sort of insane, like and very odd. But looking at it from an alpha modulation perspective, it makes sense in that the way that we process and route internal sort of thought streams and the way that we route and process sensory information, there's a lot of joint overlapping processing. In other words, there's a kind of a common sort of mind-brain set that sort of presides over both of those processes. So there's a way in which the Buddhist psychology kind of got it right a long time ago, even though, on some level it sounds very odd.
Yeah, it was, I think, based on observation and deduction. Here's what we're seeing. Here are some ideas around that. and happily they seem to have been fairly accurate, and some of the explanations and beliefs around them may not be so, but that's okay. I bear in mind this was a couple thousand years ago, and this is our predecessors' best way to understand what we're observing. And so we're taking steps today. What's our understanding of what we're observing?
And I think that, I mean, the one of the reasons they were so good at what they did is because they really paid a lot of attention to their own experience, their own inner experience. And that's really when I ask people, pay attention to your hand, pay attention to your breath. I'm really trying to talk to people who've never thought about going inside, really paying attention to that internal process. And this sort of sensory processing is a doorway for people who are unfamiliar with mindfulness that is just, I think, very comfortable for them to just walk right through.
Yeah, yeah. So let's look at another part of this, your part 5. You talk about the significance of this framework that you just described for the science of mindfulness meditation. And I like the combining of the words science with mindfulness meditation, because we are able to take specific measurements. We are able to repeat these experiments in controlled conditions. So we do need to understand that this is a different it's a different ball game than straight physics. This is behavior. This is very personal, experientially based. We can't, for example, at least today, show up on a screen, here's what chocolate tastes like for you compared to you and you and you. That's a ways off if we ever get to that point. So we do have some of that. But one of I think the big benefits to the work that you're doing, and we talked about this last time, is that there's a dismissive attitude of self-reporting as this is just placebo, and he used quotey fingers around the word just, and a dismissal of what some of what we're seeing as going on in the brain, that they're self-reporting because there's something that they're reporting. There's something going on.
Right. Yeah, I mean, there's kind of a neuroscience craze right now. So I'm sympathetic with the idea that, not everything needs to be looked at in the brain. And I'm also sympathetic with the idea that there can be a lot of bias in these studies. And my study didn't use the highest form of active control, but there are a bunch of which I don't know if people have gone over sort of the standards of randomized controlled trials, but the gold standard for a study like this is to have two competing treatments or something that where the control group is really doing something that they expect will make them better. And but there are some new studies in mindfulness that have large sample sizes that used very aggressive control strategies that have had positive findings. In IBS, we've seen that mindfulness is very helpful. And there's a study actually, so a couple of studies from Denmark, where they actually paid the control group to do the brain operations to try to equalize their motivation with the other group. And there were still some attentional changes that the mindfulness group was able to show, even though the control group was paid to perform, which is, that's kind of a very interesting
It is.
form of control.
Let's talk for a couple minutes. You also have a section on here, which I really appreciate that this is very clearly discussed in the paper, of limitations. And you describe some of those. Tell us a little bit about those.
Well, mindfulness is a very important form of treatment that's being disseminated all over the country right now. It's we're in the midst of seeing this change happen, and as that happens, and people start to implement mindfulness-based stress reduction studies in local settings, it's possible that there is a lot more heterogeneity than we've allowed for. So it's possible. I mean, one of the reasons we focused on mindfulness-based stress reduction is because there's so many different forms of mindfulness. We wanted to have something that was standardized and really well understood what the content, what it is that people are training when they do this practice. And so that's really one of the sort of basic strengths of our approach is that we only focused on this extremely well validated kind of gold standard standardized therapy, mindfulness-based stress reduction, and its variant mindfulness-based cognitive therapy. But it's possible that some of these studies that are being published, there may be people who are introducing um, variants into the standardized format without telling anybody. And I actually have heard of that quite a bit.
Yeah, and
Um,
that's part of what they discussed at the scientific conference last year is that there is an encouragement for some degree of flexibility within individual sessions, and that's very much based on what happens in the relationships between the participants and how that all works. So it's expected that there would be that kind of
there's,
variability, and
there's a little bit of flexibility and they want to maintain authenticity. But that means that that some of the assumptions that we're making about the sort of apples to apples comparison that we think we're getting by only looking at MBSR might not be true.
yeah, it's red apples and golden apples and honey sweet apples and it's a wide variety of apples in that cart.
And another limitation is that we actually tried to measure the alpha rhythms in the foot map, and we weren't successful at localizing the foot map. And so there's some limitations in our measurement tools still in terms of the way the signal is processed. And one of the reasons is that the hand signal is so strong. I think it just sort of, the connection between the mind and the hand is so strong. It's a great place to test alpha modulation, but it means that it can kind of overwhelm the rest of the map. It can kind of overwhelm the sort of electrical field of the rest of the map. So um, that's another limitation. But I think, you know, what is, I think, most important, or what the thing that we're trying to introduce is this sort of conceptual shift of understanding how these basic brain dynamics make possible sensory cognitive processing. And that, there's all of this processing that takes place just outside of awareness, that these brain rhythms are helping us manage. And that mindfulness meditation may actually change the way those rhythms manage the flow of information.
Yeah. It's fascinating for me that we're so early in our studies of the brain and mind and how it all works that, this is really just so early. And one of the things that we sometimes get is that, well, we don't have adequate controls. And as you're pointing out, we can't do double blind studies with self-reporting kinds of studies. I totally granted, but I think there's enough of a repeatable and demonstrable effect. And we do have brain scans that help show the validity of these things and measuring alpha waves, for example, that there are implications to helping people who suffer from, say, chronic pain or depression or other things that above and beyond that, for folks who may not be suffering from these things, there are real world applications for you. And it's a worthwhile endeavor to continue to grow this area of study.
Yeah, and I totally agree, Ted. And one thing I want to leave people with, especially if they're new to mindfulness, is that this is an immediately available practice. And one of the things that I encourage people to do is to pay attention to the sensations at the bottom of the feet as they walk. And that's actually an authentic form of very early mindfulness meditation taught by the Buddha. And it's very simple. You just pay attention to what it feels like when your foot touches the ground and when it's flat on the ground and when you pick it up. And, that it can actually really, it's a very sophisticated form of brain training, yet it's something that you can do in the supermarket while you're standing and waiting to check out your groceries.
Yeah, and that is always with us, as is the breath. So at any single moment, and as I conclude each podcast, every moment we have a choice. And one of those choices is paying attention. And as we can see from the work that Cathy and others are doing, that really does create change in us. So our guest today has been Cathy Kerr, and you are the, let's see if I get this right, Director of Translational Neuroscience, the Contemplative Studies Initiative at Brown University.
And in the Department of Family Medicine as well.
And Department of Family Medicine. Cathy, thank you very much for being here.
Great. Thank you, Ted.
Thanks for listening. If you'd like to learn more about something you've heard in today's podcast, please come visit the SBA website at secularbuddhism.org, and you'll find an entire webpage devoted to this and every episode. Discussion about this episode can be found on the episode page itself, along with show notes. The music for The Secular Buddhist is used by permission from John Kaizan Neptune's CD, Steps in Time. Additional music is provided courtesy of Monty Levinson of Taihei Shakuhachi and Rodrigo Rodriguez. Their websites are also linked on the SBA site on the About Podcast Music page. Until next time, remember, every moment you have a choice. Make it the best you can. See you next time on The Secular Buddhist.